Arthritis prevention. What can you do? How to avoid achy joints. An estimated 100 or more arthritic conditions exist. Although the progression of each variety is unique, all can cause significant discomfort and even disability due to changes in joint shape and mobility. Arthritis prevention may not always be possible. Factors beyond your control include your chronological age, genetic predisposition, and gender. Women are at higher risk for several forms of arthritis. While age-related joint discomfort is inevitable for most people, it is possible to lessen the likelihood of suffering by adopting some simple healthy practices. Many of these habits, including regular exercise and nutritious eating, also reduce the risk of contracting other diseases. 1. Eat your omega-3s. Polyunsaturated fats like omega-3 fatty acids have many health benefits. One of the advantages they offer is a decrease in inflammation. Scientists have found that omega-3s lessen joint inflammation caused by raw. The USDA suggests consuming 2 servings of 3.5 ounces of fish high in omega-3s, such as salmon, trout, mackerel, or sardines, every week. Generally speaking, wild-caught fish is preferred over farmed fish. Vegetarians and vegans can acquire their omega-3s from foods other than fish, such as walnuts, flax seeds, chia seeds, and other nuts and seeds. Oils extracted from plants. Examples include soybean, canola, and flaxseed. Eggs with added nutrients, juices with added nutrients, and soy drinks. Many different concentrations of omega-3 fatty acids are offered as dietary supplements. Some of the places these ideas come from are algae oil, fish oil, krill oil, cod liver oil, and olive oil are all good options for plant-based diets. 2. Manage your weight. Your knees take a lot of stress since they bear your body's weight. It can be very taxing on their bodies if they are overweight or obese. Even a modest amount of extra weight, only 10 pounds, might add 30 to 60 pounds to the force exerted on the knee with each stride. Reliable sourcing. Overweight individuals had up to a 4.55 multiplicative risk of developing knee OA compared to their moderately sized peers. Both rheumatoid arthritis and psoriatic arthritis are associated with obesity. Maintaining a healthy weight can be accomplished by a combination of dietary changes and physical activity. Cognitive behavioral therapy, CBT, may be useful if you are having difficulty reducing weight. 3. Get some exercise. Exercising helps reduce joint pain by strengthening the muscles that surround your joints and helping you to maintain a healthy weight. Because of this, they are more secure and may be better protected from wear and tear. There are 4 main sorts of physical activity, and it's best to participate in all of them. Endurance, or aerobic, exercises. Cardiovascular and endurance training involves activities such as walking, swimming, and bicycling. Besides boosting your general fitness, it can also aid in weight loss, relieving stress on your joints. Make it a goal to engage in aerobic activity for at least 30 minutes on at least 5 days per week. Strength exercises. Supportive muscle groups can be built up through resistance training with weights, elastic bands, or even just utilizing one's own body weight. Strength training should be performed at least twice a week for 20 to 30 minutes each session. Strive for 8 to 10 reps with small weights, or 10 to 15 reps with heavier weights. Flexibility exercises. Exercises like yoga, Pilates, and stretching help maintain joint mobility, prevent stiffness, and lessen the likelihood of injury. Balance exercises. Balance and posture can be enhanced with exercises such as Tai Chi, standing on one leg, and walking heel to toe. These exercises can also be useful for preventing falls in those whose leg joints are a little shaky. Incorporate some form of balanced exercise into your weekly schedule. Consult a professional. Consult your physician about the optimal exercises for your current fitness level. If you have never worked out before, ease into it and just ramp up the intensity when you feel comfortable. Initially, you might only be able to walk for 10 minutes every day. Gradually increasing your time will help you reach your goal of walking for 30 minutes. Learn proper technique from a physiotherapist or sports trainer. Alternate between working different muscle groups so that you don't overuse any one set of joints. 4. Avoid injury. Natural wear and tear on joints is a possibility as we age. Injury to the joints, whether through sports or an accident, can damage the cartilage and speed up its wear and tear. Injuries to the anterior cruciate ligament, ACL, are associated with the development of X-ray evidence of knee OA in about half of patients within 10 to 15 years. Even after surgery to repair an ACL injury, this risk remains. Always warm up before playing sports, and make sure you utilize the right safety gear. Protect your knees, wrists, and elbows, and don't forget the sturdy shoes. 5. Protect your joints. Workouts that include crouching, jumping, and carrying heavy objects could cause long-term damage to the joints. One's joints may feel the strain more acutely when lifting. Workers who frequently squat, kneel, or climb stairs, as well as those who lift heavy objects, have a risk of developing knee OA that is more than 5 times higher than that of workers who do not perform these activities. Other risk factors for OA include prolonged standing and being exposed to vibrations. Joint difficulties are common in some professions, including but not limited to those listed above. Craftsmen in construction, agriculture, metalwork, and flooring. You may reduce the wear and tear on your joints by doing daily activities like sitting and lifting with proper form. When picking something up, for instance, you should use your knees and hips instead of your back. Avoid straining your wrists by keeping your belongings close to you. 6. Quit smoking. It might be challenging to break bad habits. Still, putting down the cigarettes not only benefits your heart and lungs, but also your joints. The first systematic review of research on the connection between cigarette smoking and RA appeared in 2009. Male smokers were shown to have around double the risk of developing RA compared to male non-smokers. Compared to non-smoking women, smoker women had a 1.3% increased risk of developing RA. According to the study authors, the altered immune function associated with RA may be to blame for the higher risk. Smoking is known to increase inflammation, which is a key factor in the development of inflammatory diseases like RA. The results of your treatment may be diminished if you smoke. Arthritis drugs have less of an effect on smokers. Recent research suggests that smoking may reduce the effectiveness of tumor necrosis factor, TNF, inhibitors, which are used to treat rheumatoid arthritis and psoriatic arthritis. 7. Treat any infections. When bacteria and viruses infect a person, they don't just cause obvious symptoms like fever and chills. There are certain of these microbes that might infect your joints and bring on arthritis symptoms. A painful joint illness, infectious arthritis, is brought on by germs like Staphylococcus aureus, staph. Commonly, these bacteria enter the circulatory system and make their way to the joint or the fluid that surrounds the joint. Antibiotics are effective in treating this variety of arthritis. A 2019 study suggests that respiratory infections like colds and the flu may possibly set off RA. Reliable sourcing. This autoimmune disease may originate from an aberrant reaction of the immune system to the infection. 8. Get more ergonomic. Lessening the stress on aching muscles and joints can be accomplished by adopting more ergonomic practices at home and at work. Make sure your back, knees, and arms are supported if you spend a lot of time sitting at work. Your computer monitor should be roughly 15 degrees below your eyeline and at arm's reach from you at work to prevent neck strain. Keep your arms and hands in a natural position by using an ergonomic keyboard and mouse. You should get a chair for work that has both lumbar support and a headrest. Keep your feet flat on the floor or resting on a footstool, and sit up straight. Adjust the armrests so that your arms are at a right angle to your body and your wrists are completely straight. 9. Watch your blood sugar. Arthritis and diabetes are mutually reinforcing conditions. 4 in 10 people with diabetes in the United States also have arthritis, citing data from the Centers for Disease Control and Prevention, CDC. There is a 61% increased danger of developing diabetes in people who suffer from arthritis. Obesity, inactivity, and old age are risk factors for both arthritis and diabetes. Type 2 diabetics have an increased risk of developing OA, regardless of their body mass index, according to a 2019 meta-analysis. One theory suggests that chronic low-grade inflammation may result from having excessive blood sugar. It also plays a role in the generation of reactive oxygen species, ROS, which assist set off the production of cytokines in the joints, which are inflammatory proteins. Complications, such as nerve and retinal damage, can be avoided with regular blood sugar readings and treatment for diabetes. Treating diabetes may help protect your joints by reducing the severity of OA. Please like, comment, share and subscribe to my channel.